Organizers, I thank one and all present here. Thank you.
Okay, thank you, sir. Thank you, sir.
Dr. Amitabh Kumar, sir, for the co-chairperson. Sid Panja, sir, for the rapporteur, Dr. Chajuram Yadav, and second rapporteur as Dr. Rohit Sharma.
Is started now. Our chairperson is Sir C.M. Bhandari, sir, former ambassador India, and he has served 8 countries as an ambassador. And our co-chair is Dr. Amitabh Kumar, Dean Ayurvedic Vinoba Bhave University, Jharkhand, and Vice President CCIM, and VC and Vice President also Ayurveda. And our keynote speaker is Dr. A.L. Mahadevan. He has completed BMS from Chennai University, Venkataraman Ayurvedic College in 1993, and did post-graduation MD in General Medicine from Government Ayurveda College, Thiruvananthapuram. And in 1997, he started his clinical practice from November 97, and his grandfather was Dr. Sri Mahadevan Iyer and was a very successful practitioner in a village called Desi Samankop in Kanyakumari district. And he is a renowned Ayurvedic physician, and his classes in clinical medicines are unique in nature and most wanted among the students. So I welcome Mahadevan sir for his keynote speak.
I will start the session. Good evening, everyone. I'm very happy to see the level of attention in the audience, and that's really wonderful. And that shows that the subject that is being discussed here is very important. I come from a totally different background. As you saw, I've been in diplomacy 35 years. And yet, why I'm here? The main answer is, the past 35 years I served in many countries, 8 countries, saw what's going on. 50 years back, we never asked what is Ayurveda, what is Yoga, because we were living naturally those lives. At least I can say for me, as a child, as a student, I was naturally living a life of Yoga and Ayurveda because we were in tune with nature. But when I see my children today, they are living in virtual spaces. They are not living in nature. And the more developed a country is, the more it is now disconnected with nature. And that is why in the West there is so much demand today for Yoga and Ayurveda. I'm not saying Ayurveda. If I say Ayurveda, I'm bringing it from the West. It went to West, and then I am accepting it as Ayurveda. छठा विश्व आयुर्वेद सम्मेलन. तो मैं ये पहले चाहूँगा कि कम से कम हमारे जो एक्सपर्ट्स हैं, हमारे आयुर्वेद के डॉक्टर्स हैं, वो सब कम से कम आयुर्वेद कहें. क्योंकि एनर्जी ट्रांसमिशन जो फंडामेंटल्स हैं, अगर आपके पास फंडामेंटल्स नहीं है तो आप क्या थेरेपी देंगे साहब? एनर्जी ट्रांसमिशन ही आप नहीं करेंगे तो कुछ नहीं होना है. और हाउ डज एनर्जी कम्युनिकेट? कम्युनिकेशन साउंड. सो देयरफॉर कहा गया, आप किसी भी शास्त्र, किसी भी श्लोक को, even if I don't know the meaning, but if I know the pronunciation, if I communicate the energy, it will give you the healing effect of it. And that's why I got engrossed into yoga and Ayurveda, because in my life, there is no doctor, there is no vitamin, only nature. And this Vidya, the Vedic Vidya, the eternal knowledge that is enshrined in yoga and Ayurveda. And this is what the Western medical scientists are wanting. Why I got so much interested into it, it gave me a lot of strength in my own diplomacy. And therefore, I'm very happy that today our present government is giving so much importance to it. And from the level of participation from all over the world, I have a huge center in Poland, which is totally dedicated to only yoga and Ayurveda. And likewise, in several countries, I'm involved. And I just propagate this from my personal experiences that I have lived. And I'm very happy that to my right, I have a medical practitioner who is, again, from the tradition. Tradition here is very important. In our Poland center, I have a medical doctor. She is just about 30 years, but 10th generation Vaidya. And she will never ask you for any report. She will not even ask you if you have any ailments. She will only do your Nadi Pariksha. And I have seen, just because of that, today there is so much demand in our center, because that word has spread. Here is true Ayurveda being practiced. It's not commerce. Because unfortunately, the moment we bring in, only the commercial side of it, we lose the real practice. And therefore, very important, I think in the morning, Dr. Harsvardhan very nicely put what are the medical ethics. And therefore, in yoga and Ayurveda, if we are not keeping to the medical ethics, the Aushadhi will not work. It is true. And our doctor, she will first do a prayer before she does even just Avayanga. Or a Shirodhara is a big thing. And before doing a Shirodhara, she would prepare you mentally and then do this. So there is so much science involved in it, and not just a kind of mere, practice of it. So I'm very happy that today we have Dr. L. Mahadevan here, who is from that tradition, and not just the tradition, but who has had the medical profession to further support whatever is being practiced. Because today the Western medicine wants, okay, give us the clinical evidence or explain the scientific basis of it. And that's what we need to present. And if we can do so, I'm sure yoga and Ayurveda are bound to be the leaders for the future health, integrated health, good health of humanity. So with that introduction, I'd like to invite Dr. Mahadevan for his talk.
Respected chairperson, co-chairperson, respected Vanida madam, president of CCIM, respected Singh sir, beloved Jayaprakash Narayanan sir, Jain sir, my friends, ever-loving students. I am really honored, happy to be here, and I am glad that you show great interest in my classes in the usual way. You can record if you want to record. You can take video if you want to take video. If you want to present my paper again somewhere else, also I permit you. No problem. Because what I talk is from the text, it's not original. So you do whatever you want with my presentation. He introduced me nicely, so I thank him. The man who introduces you is very important. Last year was the 150th anniversary. Increase the volume, if possible. Last year was the 150th anniversary of Swami Vivekananda. So I used to give lectures in Vedanta and Yoga also. So I gave a lecture in Kanyakumari. So in school, I was about to talk about Vivekananda. The principal was very highly Vada Prakriti. Beyond Vadam is beyond Vada Prakriti, Vada plus. So he came to me 5 to 10 times and asked, are you Dr. Mahadevan? I told, as far as I know, I am Dr. Mahadevan. because he confused me so much. So I told, I am Dr. Mahadevan. He told, will you talk about Vivekananda? Yes, sir, I am talking continuously since 3-4 months. I am doing the same thing. Then he went to the stage and told, now Swami Vivekananda will talk about Dr. L. Mahadevan. So, introduction is very important. So, introduction, it starts the tempo. It's like a first scene where the hero enters into the cinema. How to operate this, Saju? It looks different, yeah. Now, I am going to tell you the fundamentals of Ayurveda before I enter into the topic. We all call health Arogyam, Arogasya Bhavaha. The health is the word used. Health is a state of dynamic equilibrium. A man may not be having a finger, still he will be healthy. That is our health. It is a dynamic state of equilibrium, and we call health as Ojas. Tejo yat sarva bhudanam Ojas tatparam uchchade mrudu somatmakam. There is Soma and there is Tejas. Imagine this. It should get neutralized, but it doesn't get neutralized. A man is having prolactin, FSH. A woman is having testosterone. If you go to a Hindu temple in Tamil Nadu, they would have painted red and white. They would have painted this color. They didn't do that. It is a vision. It is a beautiful vision of this Bharata. Bharata denotes Bhavam, that is Kapha, Ragam, that is Pitta, Thalam, that is Vayu. Lub, dub, 2:1 AV block. It will tell you, it's Vada problem. Kapha Vardavadam, Kadrasam, Ushna Prayogam, Pramadi Aushadha. So in this culture, there is Shidam and Ushnam. When prolactin increases, you get gynecomastia. When testosterone increases, you get PCOD. So, Saumya Agneyam Jagat. The Sauma Agneyam is mentioned as Ojas. Ojas is represented as Agni. This Agni is Shida and Snigdha, but still Agneya. That's a beauty. Snehameva Param Vidyad. Where are my Kadapa? Snehameva, Saju, change the mic. Snehameva Param Vidyad. Durbala Anala Deepanam. Vyadimuktasya Mandagno. Vyadimuktasya Mandagno. Sarpirevadu Deepanam. You see that? Vyadimuktasya Mandagno. Sarpirevadu Deepanam. The Gridam is Shida Snigdam, but Agneyam. Gridam is Agneyam. Hemanta Rudu is Agneyam. Shida Snigdam, next month is Hemanta Rudu. You get appetite. Morning 4 o'clock you want to eat. Hemanta Rudu is Bala Uttama Rudu. Shida Snigdam Agneyam is your health. When the Shida Snigdam Agneyam is converted into Adishidam, this Adishidam is Shishira Rudu. Then Ushna Snigdam, Vasanta Rutu. Woman is considered as Ushna Snigdha. All women are Ushna Snigdha. Ushna Snigdam is Abhishanti. Dadi is Abhishanti. Masham is Abhishanti. Matsyam is Abhishanti. That is why in Magadhi Garbhavakrandi they tell you take Masham. Because Masham is Abhishanti. Men are Pramadi. In a broad sense of reality. Opposite of Abhishanti is Pramadi. You are Abhishanti, Vasandam, Vasandakala Nadigalile, Vairamani, Niralegal. Only women are written poem, woman is compared. Men are not compared. Kalangalil aval Vasandam. Among the Kalas, she is Vasanda. Only she. Because she is Abhishanti, this Abhishanti makes you to write poem. You see, you need Snigdha. Snigh is love. Snihyade idi. Among the 7 dadus, 6 dadus are having sneha property. Rasam, sneham. Raktam, sneham. Mamsam, sneham. Majja, sneham. Asti, no sneham. So men won't get osteoporosis. Shukram, sneham. If you want to write a love letter, snehamulla kavidavukku. Snehamulla kavidavukku. You cannot write rukshamulla kavidavukku. My dear Rukshast Kavida, your love will be a failure. So, Slik Alingane Yidi Sleshma. isn't it? So you need that. Then Ushna Ruksham is coming. Ushna Ruksham is Grishma Rutu. Then Shida Ruksham is coming. That is Vasanta Rutu. Then Ushna Tiksham is coming. That is Sharad Rutu. My dear students, if you understand this, the Shida Snigdam Agneyam with Ama is Jwara Chikitsa. Ushna Tishnam with Ama is Vadarakta Chikitsa. The Chikitsa starts with the Jwara. The Chikitsa ends with Vadarakta. After Vadarakta, no chapter is written. The Ashtanga Hridaya maintains that. There is a protocol. This protocol is not randomly selected. There is an intellectual wisdom behind this protocol. Charaka wrote, this mic is highly disturbing to me, I tell you. Because it affects my manodharma. You keep it here. I am shouting. Usually I use my own wife, my own car, my own thing. From next seminar, I should bring my own mic. So, this Rutu, then after Vadarakta, only Rasayana. Because Vichurunidam, Damani, Anguli, Sandhinam, Sankocham. One fellow asked me, sir, in Vadarakta Chikitsa, they have written, when man is having severe pain, Priya Priyam Vadacha Narya, Chandra Ardagastanaha, the man with swan neck deformity, buttonhole deformity, ulnar deviation, carpal tunnel syndrome, fibrous ankylosis of elbow, what will we do with the woman? I told, go and ask Vagbhata. Because I don't know. Because sometimes they will ask, why Susruta did not tell about Majjavagasrodhas? How do I know? I do not know. So it is the guna that is everything. There is nothing called Vada. Vada is a name given to guna. Among the Vada, Tatra Ruksho, Lagushi, the Karasuksho, Salanilaga, first three is Sharira Guna. If you put the opposite, it will become treatment. Remaining three are Manasika Gunas. That is for every dosha. Shukshma, he is not a magnanimous personality. Chala, he is highly restless. He is Chala, Chale Vade, Chale Chittam, Nischale, Nischalam Bhaved, Asamsayam hi Mahabaho, Mano Durnigraham Chalam. The respiratory rate of a monkey is 32 per minute. The respiratory rate of human being is 16 per minute. The respiratory rate of elephant is 8 per minute. The respiratory rate of tortoise, Kapha Prakriti, tortoise, Katinam, it is 3 per minute. It lives for 300 years. You should become like tortoise by using Ayurveda. So this is the guna. Gunas are understood in clinical practice by avastha. There are various avasthas. Avastha means you have to study jwara. Jwara denotes avastha. Ama avastha, Pasyamana avastha, Pakwa avastha, Uttana avastha, Gambira avastha, Ashugari avastha, Chiragari avastha, Antarvega avastha, Bahirvega avastha, Sharira avastha, Manasa avastha, Chaya avastha, Prakopa avastha, Prasara avastha, Leena avastha, Jwaram. Deepanam, Pajanam, Sneganam, Swedanam, Vamanam, Virejanam, Vasti, Raktamokshanam, Devavabasarayam, Jwaram. But one thing is not mentioned in the Jwara, Lehyam. Because it is Abhishanti and Kledam. In Jwara Chikitsa among the 180 chapters, Lehyam is not mentioned. It's a big matter for debate. Now when we assess Jwara Chikitsa, we can understand all these things. So the Rudu happens every 4 hours within the body. From morning, morning you have Hemanda, every chakra there is Rutu. You can meditate with this guna on the Shat chakras about the Rudu, and when a patient comes to you, in which Rudu he is coming, that is very important in practice. Rudus are nothing but the expressions of guna outside. Doshas are nothing but the expressions of gunas inside. That's all. There is nothing big deal. You don't have to believe anything, only you have to understand. To understand, you need a teacher. You don't need professors, lecturers, but you need a teacher. A teacher who practices medicine. Somebody comes to you and tell Gulma. You ask him, what is Gulma? Vada Udara, Vada Gulma, Vada Udavarta, Vada Shula. What is the difference in day-to-day practice? That counts. 6 gunas, Charaka says. Vagbhata told only 2 gunas are enough. 2 gunas are enough. Vadam is Shidam, Kafam is Shidam. Vadam is Sandarpana Shidam, Kafam is Vadam is Apadarpana Shidam, Kafam is Sandarpana Shidam. Vadam is Lagu, Pittam is Lagu. Vadam is Chalalagu, Pittam is Saralagu. Pittam is Snigdam, Kapam is Snigdam. Pittam is Ushna Snigdam, Kafam is Shida Snigdam. Ushna Snigdam is unsaturated, Shida Snigdam is saturated. Shida Snigdam is coconut oil, Ushna Snigdam is Tiladailam. Abdi, taste arugum. Guna is an addiction, I tell you. Now I will tell you how gunas works in practice. Now I will assess. Now I am going to teach you any disease. You open horizon, you challenge me. Any disease, I will put a guna samprati. It's possible, I am doing all the time. Everything is guna. So you have a vada vyadi. Vada vyadi in a stula dehi, vada vyadi in a krisha dehi. Immediate vada vyadi, late vada vyadi. You select 2 drugs, rasna and bala. You say rasna, kadu rasam, kadu vibhagam, ushna vibhagam, stula dehi, kafanu bandavadam, avaranam, navavastha, rasna. You don't give in osteoporosis in a lean person. Sir, I am struggling to talk. There is no AC first, that's okay. Then mic is a problem. You keep another mic. Mic should be like wife. So you take bala, kshira bala, madura rasam, madura vibhagam, Shida Viryam, Guru Snigdha Gunam. Sagajaram, Erandam, Shundi, Rasna, Suradrimam, Lashunam, Kafanu Bandavadam. One side. Demyelinating neuropathy. Okay. Cardiomyopathy. Polymyositis. Kadurasam, Vishnaviriam, Pramadi. Tippali, Chitrakam, Shilajat. Leave it. Krishadehi, osteoporosis. Jogren syndrome. Jogren syndrome. Have you heard about this? Jogren syndrome. Madhura Rasam, Madhura Vibhagam, Shida Viryam, Guru Snigdha Gunam. Bala, Vidari, Eshtimadu, Draksha. You cannot randomly select. If Yogaraja Gugulu is not available, you give Maga Yogaraja Gugulu. How you can you give? Dosa is not available, bring Masal Dosa. It's not that. This contains Nagam, Vangam, Yasadam, Yagaguna Sinduram. That contains only Yagaguna Sinduram. Who told this? Something. Mixing denotes uncertainty. Don't mix. Now you select, for example, now Vada Vyadi we discussed. Now Kushta Chikitsa. Tikta Rasam. Medya Dravyas are Tikta in nature. Everything you have to divide Vada Pitta Kapha. Trifala. It's not working. But I am shouting. This Tikta Rasa. For healthy person, Madhura Rasa is best. For unhealthy person, Tikta Rasa is best. That is why Jora starts. Langanam, Swedanam, Kalo, Yavago, Tiktago Rasa. Tiktam is superior. Sir, later, sir, already it's affecting me. Kala Pramana Tapparadille. So, Tiktam, you have 2 Tiktas. Shodhana Tikta, Shamana Tikta. Kadugarogini, Shodhana Tikta. Bunimbam, Shamana Tikta. Padolam, Shodhana Tikta. Nimbam, Shamana Tikta. Shodhanam, Uttama Shodhanam, Madhyama Shodhanam, Hina Shodhanam. Padola Moladi, Uttama Shodhanam. Padola Kaduroginyadi, Madhyama Shodhanam. Vasa Guduchadi, Hina Shodhanam. Tikta Shodhanam. Madhura Brahmanam, Uttama Brahmanam. Madhyama Brahmanam, Hina Brahmanam. See this? How the Sansra, it's like making a garland. Beautiful. You cannot tell Ashwagandha is anti-inflammatory. Do these things first. At the end you tell that. Vada is serotonin, Pitta is GABA and other things. You tell at the end. Now we are going to see Kadigraha, and I am going to do Guna Samprapti. Everybody is having Kadigraha. Without Kadigraha, Ayurvedic doctors will die. Because 70% of their case is Kadigraha, which get cured automatically. And they get name and fame also. Actually, that's a fact. Kadigraha can by lift. In Indian road, if you travel Kadigraha, if you lift your wife Kadigraha, if your wife lifts you, then Kadigraha. And if she puts you down, then that is major Kadigraha. Isn't it? So mechanical causes of Kadigraha. You have mechanical causes, structural causes, non-mechanical causes. Now you see how I am going to handle. Now this is the case. L4, L5 disc protrusion, left sciatica, compensatory scoliosis, motor weakness, nerve weakness, bladder features are minimal, unbearable pain to sit, DTR is absent. People used to ask me when they talk about Urustama, what is Urustama, what is Urustama? I used to tell them, when you assess Urustamba, you call it paraplegia. This paraplegia patient has attained 3+ power. He was able to walk. So he is advised to swimming. A man who cannot walk cannot swim, isn't it? That's logical. That's logical, isn't it? So, this is a wonderful thing. He had headache. Headache is documented. Vomiting is documented. But in a case of paraplegia, two things are needed that are not documented in Urustaba. What are they? One is bladder control. Another one is erectile dysfunction. These two are not documented in our Urustamba. So our Urustamba is a patchy arachnoiditis with demyelination with self-spontaneous recovery, sparing S1 and S2 segment. See this, how beautiful it is. It is an observational statement. It's not organic. There is no bladder involvement. If there is cardiac vena, then it is bladder involvement. In conus medullaris, it should not be. In conus medullaris, reflex should be brisk. There is chalavriddhi. If reflex is absent, that is manda avrita chala. Our people do not think all these things. Semen is not entering into the uterus. Yonauta shukra pradibhadanau. It is called, what is it is called? Asthenospermia. In asthenospermia, chala gunam is kshaya, manda gunam is vriddhi. So you have to give kadurasa. Kadurasa will increase chala and reduce manda. Our people will give vidaryadi. Vidaryadi is maduram. He will not become pregnant. The man who is living in the fourth house will become pregnant. And he will blame Ayurveda. It's not our mistake. And our people ask questions in different way. Because they are trained monotonously in the college. Do you have diabetes? No. Whether your parents have diabetes? No. You have hypertension? No. Whether your parents had hypertension? No. Do you have children? No. How many years you do not have children? 5 years. What about your parents? Then they will conclude. If parents are sterile, then children are also sterile. See that? That's the beauty. Only our people can do. So here you are selecting Kadurasa. Why it is important? Vada, there is a rasa. What is a rasa for Vada? Maduram, Amlam, Lavanam. Pitta, there is a rasa. Kapha, there is a rasa. Vada Pitta, there is a rasa. Pitta Vada, there is a rasa. Kapha Pitta, there is a rasa. Pitta Kapha, there is a rasa. Vada Kapham, if you select example, Vada Kapham is stroke. Kapha Vadam, bronchial asthma. Pitta Kapham, herpes zoster. Kapha Pittam, eczema. Isn't it? Like this you should assess. But when you tell everything rasa, Vada Kapha, what is the rasa? There is no rasa. There is only virya. Shide, Shida, Pradikaraha, Ushneja, Ushna Nivaranam. Acute infarct. Patradarvadi Kashayam, Karuppu Vishnu Chakram, Chandamarudam, Viryam. Tikshananasyam, Viryam. Hypertensive cardiomyopathy, Viryam. Lumbar canal stenosis, Viryam. Fibroid uterus, Gulmam, Viryam. Hingutriganam, Viryam. So Viryam plays a major role. Here Viryam, Kadurisam, Ushna Viryam, Kapagaram, Pramadi. So now what I have given? Sakajaradi Kashayam, Tikta Kadurasam, Ushna Viryam, Kapagaram, Medasa Pravilayanam, Kotanjukadi Taidam, then Vaidaranavasti, Tikshnavasti, because I have given acute disc prolapse is considered as a Kapha Avardavada. So Ushna Pramadi is given here. I do not select Kshirabala. I will not select Pindadailam. I will not select Danvandaram. I will not select Danvandaram Kashayam. I will not select Gandharavastadi. Are you clear? You should not. Then next case. After this Kadurasa, Vada will increase, Pitta will increase. When Vadam and Pitta are increasing, you have to give Madhura Rasa. What is Vada Pitta Shamanam, Madhura Rasam, Adakaya Visesham? Which Kashayam is there? Anybody tell me? Danvandaram. Then Vidaryadi is there. You can ask me, sir, Vada Pitta Shamanam, Madhura Rasam, Madhura Vibhagam, Sida Viryam, Guru Snigdha Gunam, Vada Pitta Shamanam. Why you are not selected Vidaryadi? Because Palasrudi of Vidaryadi is above Nabi, Danvandaram Palasrudi is below Nabi, Sthanam means receptor, so I have selected Danvandaram. This is how I teach, you know. Daily 8 hours I teach my students in my Gurukulam. The greatest thing is nobody learns. But I learn. I have dedicated my life to teaching. Morning 4 o'clock teaching starts. Night also I teach. I become mad by teaching. Let it be. Teaching is the greatest joy, I tell you. People without the joy of teaching should not become teachers. They should go to some other job. Teacher is something, you know. Adurasya andar atmanam. Jnana buddhi pradipene. You should, it's a passion. When I teach, students should cry. I have made students cry after the class. Students will cry because of emotion. Kadigragam, Rasna Sattagam, Kadurasam, Ushnaviryam, Trika Viseshatvam, ankylosing spondylitis. Rasna Panjagam, Tikta Kadurasam, Ushnaviryam, Dadu Viseshatvam, osteoporosis. Gandharavastadi, Koshta Viseshatvam, spastic colon. Cheruvulvadi, Kadigraganasanam with piles. Fibroid, Varunadi. Gulmaharam. Sukumaram, Mutragadanashanam, Mutrasmarinasanam. Danvandaram, Madhurarasam, Sidaviryam, Brahmanam, lumbar spondylosis, degeneration, Rukshavriddhi, Karavriddhi, where Snigdhada is needed. Maharasnadi, Yonirogan, endometriosis. Ashaya Apakarshaka Gati. Maharasnadi, Visesha Palasrudi. Samanya Palasrudi, Visesha Palasrudi. Visesha Palasrudi is important. Now, I have, because Kadirasa, the disc treatment is over, I am giving Danvandaram, Sukumaram, Danvandara Avarti, then I am giving Kshiravasti. Guda Nirvapanam Param. Gudam is Sadhya Pranagara Marma. That is why while doing Vasti, I have reduced the size of Vasti. The Vastinetra need not be so big. It looks like AK-47. I made it small. But it works. It's a huge one, you know. When I showed it to the patient, he ran away. Another fellow came. He didn't talk and he didn't allow me to talk. He just kept it in his mouth. I asked, why do you do? He told, I am a saxophone player. So I told him, what you did is not correct and I am very shy to explain it to you. Morning 11 o'clock you come. I will teach you how we play saxophone. Then he came by 11 o'clock. Then he saw, then he left the place. Then he wrote a letter, Guruji. He doesn't know, in Nagaland and other places now only Panchakarma is developing. I am giving lot of classes to those students. He wrote a letter to me, Guruji, I had miserable experience with Vasti Netra. So I am not going to practice it. Send me 5 Virechana Yantras. Then I told him, there is no Virechana Yantra. You have to sit and finish the work. No Virechana Yantra available. So he was calling me every day and he was calling my wife. She told, whatever it is you send, what husband you are, she was started telling. I told you, he cannot send it. Then at last he sent 500 rupees money order. Then I bought 5 mugs in red color and sent it to him. Then after that he wrote an email, thank you. That is the greatest part of this story. So, there is an authentic way of learning, isn't it? Authentic way of learning. You should tell joke. If you go to some classes, Padartha Vijnanam, they'll be very serious, as if something had happened. Some nakshatra has fallen down. When I saw some of the lecturers, my curriculum, I prayed, Bhagavan, I should not become like them. That was a prayer. That was a prayer. Already this man is completing physics, chemistry, biology. He is studying Nyaya, Vaisheshika. One fellow is sitting. At that time, Guru, after eating, will sleep in the lap of the student. So, they used to sleep. I don't do that. We don't do those things. This fellow was sleeping. Then 2 scorpions came. Then these scorpions took Kudi Praveshika Rasayana, took some Bastriya Paranayama, learned from our sir, took everything because he is a yogi, he learned everything. And he told, I will beat this fellow and he will die. Or by seeing, he will urinate and die. Okay. The other scorpion told, okay. That scorpion was studying BAMS. That's a problem. In Agadadandra department. Another joke is, in one Anagadadandra department, snake escaped. And it went and bit the HOD. Snake died. Now come to our scene. This fellow went and scorpion bit at the thigh. Nothing happened. Scorpion bit at the thigh, nothing happened. They were happy. Again bit, not happened. 3 times. The students is sitting like this, with a full kumbhaga. He is sitting. Then, Vaidyaraja Namastubhyam Yamraja Savodaraga Yamasta Arade Pranan Vaidyo Pranan Dhananijay. The scorpion asked this BAMS scholar, first year, Sir, people will urinate when they see me. But you are sitting like a stone. What happened? Is my sting not painful? Then Guruji replied. First year BAMS professor replied. This fellow replied about the professor. Yes, I am afraid of you. I was shocked with you. I started urinating just to see. It's flowing towards northern direction. So, east, west, everywhere it is going. But I would have cried. I would have opened my mouth. If I would have opened my mouth, this fellow would have got up. If fellow would have got up, he would have started Padartha Vijnanam. So that is how we run the curriculum. Oh, we need change. We need inspirational teachers. You teach and take them to ecstasy. You take them to ecstasy. In the ecstasy, knowledge comes. It will, like a blossom, it will come. Yuvadam Bittangabachedi Trayodosha Samasadaha. Samasadaha, many people do not know the meaning. It is Sannibada and Samsarga. Many people do not know. Pittam Sasnegam, Sa. Many people do not know. I asked one fellow, what is the main ingredient of Shavana? He told, Shavana Prasham. He told Shavana. I told, it contains lot of seeds. How will you do? How will you do? Whether you will fry it directly or remove the seed and fry. He told, better remove the seed and fry with ghee. People have different opinion. One patient came to me and told, I have severe itching sensation in kidneys. You understand? We have to teach them. These people come to OP. So I am giving Madhura Rasa. You see the disc? The disc is protruded, extruded. Now the disc perhaps is gone after Vasti. The neural foramen is free. I have done 200 cases. Desiccated disc, bulged prolapse, third 3 annual lever paracentral extrusion causing thecal compression. See after Vasti? Comparing to previous MRI, disc prolapse, left recess encroachment shows significant regression. There is no prolapse, my dear child. It is gone. Where does it go? Child is coming from the labor. Can you put it in? So anything that comes should not go. That theory is not correct, isn't it? In pregnancy, it is not to happen. Shastra also doesn't allow. You take a big balloon, put it there. After 1 week you go, it shrinks. When canal diameter is more than 9 millimeter, the reabsorption takes place because of the anulomana, rutshana, karshana and pramadi. It depends on the canal diameter, my dear students. Up to 6 millimeter canal diameter. Tell, no surgery. We will reverse it in 14 days. Write and give. Ask any neurologist to talk to us. Let them talk to us. Orthopedic surgeons, talk to us. They will end up in discitis. They don't put titanium plating. How many cases? Now cauda equina, same treatment. See this? Massive disc. Reversed. Svedam. You have to give Svedam. Apanam is Vadasthana. This is Kafasthana. So in Kafasthana, Kafam is Snigdha. You have to give Rucha Svedam first. In Vadasthana, you can directly go for Snigdha Sveda. This is a very important point. Don't put oil and rub here and there. Ayurvedam is not rubbing oil. I have stopped using the spiritual Navarakadi and all. Most of the time they are useless, I tell you. Grahani. Dadunant Saidilyad. What? Prameham. Prameham Pandu, both. Charaga Pandu, not Susruta Pandu. Charaga Pandu, both are different. In Susruta it is not told. Charaga Pandu, Rakta Pandu. Rakta Pandu is different, Rasa Pandu is different. There. Pittam, Kashaya Tikta Maduram, Pittam Anyedu Kurvade. Kevala Pittam, Tiktam. Kapanubandha Pittam, Kashayam. Vadanubandha Pittam, Maduram. Kevala Pittam, Guduchyadi. Kapanubandha Pittam, Aragodadi. Vadanubandha Pittam, Vidaryadi. Abde. Understand? How is it? Tasty? Is it tasty? Enjoyable? Yeah. I have written whole book like this. 15,000 pages are going to be released in December 19th. You can see that, the brochures. I am conducting 3 days. I have written whole Madhava Nidanam based on Harrison. 15 chapters are going to be released. My 400 hours of lecture available for sales. All you are hearing. You need not come to me. Put it in the car here. You get knowledge. And teach others that you have invented it. If possible, tell my name. We are releasing 60 books. Sakasarayogami, Amrudottaram. Why are you taking, boys? I will give the paper. Anybody who wants the paper, take it. You take, you record also, but if you want, I will give. Pachanamridam, Guduchyadi, Bala Guduchyadi, Amrita Shadangam, Shaddaranam, Mahavadavyadi Prasamano Yogaha. Where it is told? Chakratattam 5th sloka. Vadarakta. What is Mahavadavyadi? The guna is important. Doshagi, ನಾನಾವಿಧ ದುಷ್ಟಿ ದುಷ್ಟೇನ ಪ್ರಾಕೃತಾ ವಾ ವೈಕೃತಾ ವಾ ಅನುಬಂಧ ರೂಪೋ ವಾ ಅನುಬಂಧ ರೂಪೋ ವಾ ಏಕಸೋ ವಾ ದ್ವಿಷೋ ವಾ ತ್ರಿಶೋ ವಾ ಸಮಸ್ತೋ ವಾ ಅನ್ನೈಶ್ಯ ರೂಕ್ಷೋ ವಾ ಅನ್ನೈಶ್ಯ ಭಾವೈರ್ವಾ ರೂಕ್ಷಾದಿಭಿಗಿ ದೋಷಾಗಿ ವಿಕಲ್ಪನೆ ವಿಕಲ್ಪಮಾನ ವಿಕಲ್ಪಯಂತಿ ಇತಿ ವಿಕಾರಾನ್ ಇತಿ ಸರ್ವ ವಿಕಾರ ವಿಗಾದ ಭಾವ ಭಾವ ಪ್ರತಿವಿಶೇಷ ಅಭಿನಿರ್ವೃತ್ತಿಗಿ ಭವಂತಿ ಹೇತು ಇತ್ಯುಕ್ತಃ. ಹೂ ಟೋಲ್ಡ್ ದಿಸ್? ಇಂದು ಸಸಿಲೇಖಾ ವ್ಯಾಖ್ಯಾನ. Nobody reads Hindu. Who is Hindu? He is my girlfriend, like that they talk. ಗುಣದುಷ್ಟಿ ದೋಷಾಗಿ ನಾನಾವಿಧ ದುಷ್ಟಿ ದುಷ್ಟೇನ ಪ್ರಾಕೃತಾವ ವೈಕೃತಾವ ಅನುಬಂಧ್ಯ ರೂಪಾವ ಅನುಬಂಧ ರೂಪಾವ ಏಕಸೋವ ದ್ವಿಷೋವ ತ್ರಿಶೋವ ತಮಸ್ತೋವ. 1 year class, 1 year. I take 1 year class. 5 students left, cried and left. Sir, I will not come. You are highly cruel. See, kadurasam, kava pradanyam kadurasam, vada pradanyam madurarasam, kava pradanyam guguludiktakam, varada pradanyam madhyashtiyadi ksheerabala, kava pradanyam balladakam, vada pradanyam ksheerabala. Narayana Dailam, why it is called Narayana? It is not Bhagavan Narayana. 50% is Shadavari. The Paryayam of Shadavari is Narayani. That is why it is called Narayana Dailam. Now I will come to next topic. Because I have, next is Tradvitya Sambhasha. I have to meet Gopakumar, on the stage. He is Singham 1. I am only Singham 2. Meeting him on the stage, the only one person whom I am afraid of. We are very close, but he is fantastic. He is talking some there, I am talking here. It's very sad, we are staying together. The Guduchyadi Ganayapana Vasti, Rasayanam, osteoporosis, Tiktarasena Kshiragridadu Beshajam. You need a medicine which is Karam, Abhishanti, Snigdam, Tiktam. It is not available. So you make it. Namaste, madam. How are you? So, Tiktam, Karam, Abhishanti. Santa, what are all the medicines told for bone? Bone is very important. Maximum number of pores are inside the bone, that is Agasa. Bone is the strongest thing, that is Prithivi. See how Kaphavada works? Full of Agasa Buddha and full of Prithivi Buddha. The Agasa Buddha is not taught to in the classes. Have anybody taught you? Astino Maruda, Asti Marudayoho Naive. Astani Stido Vayu, Pittandu Sedarakteo, Sleshmanaha Seshani, Tena Yesham Asraya Asrayina Midaga, Tena Yad Yegasya, that Anyasya Vardana Kshamana Ushadam, Asti Marudayoho Naive. Tiktam, Vada Vardanam, Karam, Ruksha Vardanam, Akasha Vardanam, Abhishanti, Ganavardhanam. So you make Negrodadi Ganakashayam, Sandaniya Ganakashayam, Priyangu Kshirakashayam, Laksha Kshirakashayam, Guguladiktaka Gradam with the Kshiram. Now we are going to debate whether milk is good or bad. That is my next topic. I don't know what to tell. I told you anything you tell it, we will adjust. We are departmental stores, Everything is available. DEXA scan, dual energy X-ray absorptiometry. Many doctors do not know. They do massage and the micro fractures will come. I have seen. Anybody with kyphosis, woman, thin body, at least do a DEXA scan. At least in one area, left hip alone. 1,500 rupees. Save the case. Don't rub with oil. Paget's disease. This is another disease, localized bone disorder, severe bone problem. You see this? Bone pain, osteoarthritis. You see this? Severe sclerosis here. You see that? Sclerosis. So you come here. Operate that. You operate that. You see the sclerosis. You cannot see this sacroiliac here. The whole bone is cordless. Bone is soft, brittle. Now you see. I ruled out multiple myeloma by doing a test called serum electrophoresis for M band. Oh no. See, diagnosis is Paget's. Written by me, Mahadevan. Paget's. Metastasis. Metastasis I ruled out by PET. See the score. Before, Tikta Rasayana Kshira Gridad Beshajam. 22-93. Now after Google Tikta Grada, you see. Snagabana. Now you see. Now you see. Patient is normal. No problem. Hearing normal. Hearing preserved. People tell it is incurable. Who tell? They give alendronic acid. Once you give alendronic injection, they may get tuberculosis, fever. No. Tikta Rasayana Kshira Gridad Beshajam. Then multiple myeloma. Bone cancer. Again back pain. People came with back pain, but it is cancer. Agni Deepanam, Amapajanam, direct Rasayanam. So in Asti, there is a cancer. So I will tell you one point. Use all Vishamajjara in all autoimmunity conditions. Autoimmunity in Rasa, Alopecia areata. Autoimmunity in Rakta, SLE. Autoimmunity in Mamsa, polymyositis. Autoimmunity in Medas, Hashimoto's thyroiditis. Autoimmunity in Majja, demyelinatin. Autoimmunity in Shukram, anti-sperm antibody. Take it from Vishamajjara. See, the whole Palasruti of Vishamajjara, if you go to Apasmara Chikitsa, all the Gridas, only one Grida is told, Panchagavya in Apasmaram, all other Gridas, Mastulunga Sadursam Gridam, they are told in Unmada, in all the Gridas, Chadurdaga Juram, Palasruti is mentioned. Chadurdagam involves Majjadadu. In Majjadadu, demyelination, aplastic anemia, chronic myeloid leukemia. Give this Kashayam, fourth Jara Kashayam. Padolam, Kaduroni, Musta, Haridegi, Madugam, Guduchi, Amalagi. See this, how we use? Go and read it today. Whether I am telling is correct or incorrect, check. Take Unmada Grida Praharana, read everything. Use it. When multiple myeloses come, don't run away. Then I give Siddha medicines. Siddha is an amazing Tamil system of medicine. You do not know the potency of Siddha herbs. I was practicing Ayurveda like this. After studying Siddha, now I am like this. I improve, I became a better person. Pravala Pishti, Chitramuladi Guliga, Idivalladi Medigi, Balladaga Gridam. SKM is making, they are having a stall. Balladaga Gridam is available. Use it. Then tumor in uterus. Myoma, back pain. Myoma, back pain. What is the problem? People give Kadirasa, Varunadi, Ingojadi, Shovuliga. Bleeding starts. Why? For Kapha, what they are telling? Shidena yuktaha, snigdadyaha, kurvanti sleshmena sanjayam, ushnena kobam. Ushnena kobam, when the granthi, mahabudam, magad granthi budam is there, you are giving ushna virya, kapha melt and adipravarti takes place. So you are not supposed to give varunadi there, you are not supposed to give chitragamuladi there, you should give trayantyadi and shilajat rasayanam. You see that? Fibroid. It's over, sir. Fibroid gone. No lesions. Any fibroid up to 3.2 centimeter is reversible if the hemoglobin is more than 9. So you should know what the Shastra is. Gulma Chikissa. Gulma means Vada Kapha. Vata Kapha, there is no rasa, only virya. Gulma Chikisa is treated with churna. Gulmam contains 25 churnas. Maximum number of churnas are told in Gulma. Prostrate, go to Gulma. Stroke, go to Udavarta. Multiple myeloma, go to Vishamajvara. Expand your consciousness of including everything from Tridoshik Guna perspective. You will become a wiser person, wiser doctor. It's very interesting to treat. So many complicated cases come. When they come, I put Guna Samprapti. That's all. Many years disease, Vadavirdi, Prittavirdi in Kapasthanam. Sthanika dosham, Agandho dosham. It's very important. So if you are with me for 7 days, I am not talking about the seniors. The budding flowers, budding students of Ayurveda, sometimes you may be frustrated, disappointed. Why we have studied Ayurveda like that? If you are with me for 7 days, I can change your brain and consciousness, I tell you. With this word, I conclude my session. There.
Thank you, Dr. Mahadevan. I'm sure you have enjoyed the talk. Since we are running already short of time, I only want to say that whatever he said, I'm not an Ayurveda doctor, so still there was so much knowledge in it, and only if we can translate it to a layman's language so that an average person can understand how their own body is actually being taken care by nature, and how simply by modulating the inputs, the Vata Kapha Pitta, that's all the time being talked, how it goes into imbalance and how it is brought back to balance, and how even incurable diseases in modern medicine can be taken care of through Ayurveda treatments, and especially the Shastra. My conviction with Shastra is supreme. Why? Because I have gone through such experiences where I have seen that whatever is written in the Shastra, you cannot challenge even a comma in that. It is so accurate and open to scientific validation, and that's what is happening. At least in the yoga field, which I am myself involved, I have seen it, and that's where I think we are able to now convey this message that for the future, in the health side, yoga, without yoga and Ayurveda, you cannot really take care of the non-communicable diseases. The allopathy can take care of communicable diseases, but the current day's lifestyle non-communicable diseases, they can only be taken care through these the ancient knowledge of Vedic literature. I'm sorry that we have run out of time, but we have 8 speakers, and we would like to invite them one by one. 7 minutes for each speaker, and I will request all the speakers to kindly see if they can stick to that time. And as you come here to save time, if we can changing a speaker also, if we can save time, that will be nice. So our first speaker is Ruvini Mendes. Please come.
1 minute, sir. Dear students, those who want the CD can get it from my secretary, or I will upload it today in my website. You can download it. And regarding the seminar also, you can get the brochures from my secretary and my publications. Thank you. I will hear, I have 8 o'clock, there is a Tadvidya Sambhashana. Yeah. Main hall, plenary hall.
Good evening, everyone. I am Dr. Ruini from Sri Lanka, working at BMRI, Bandanayak Research Institute. This is my topic, permanent excision of common warts with a non-surgical method,
Give brochure to sir.
traditional medicinal paste. Common warts. A wart is a small rough growth resembling a cauliflower or a solid blister. It typically occurs on humans' hands or feet, but often in other locations. Warts are caused by the viral infection, specifically by one of the many types of human papilloma virus (HPV). In allopathic system of medicine, cryotherapy is the main procedure associated with wart removal. One complicating factor in the treatment of warts is that the warts may regrow after it has been removed. Ayurveda perspective, massacre is one of Shudra Roga, which can be symptomatically similar to common warts, human papilloma virus. This should be exist and the area should be burnt either with causative alkali Shara karma or with fire, Agni karma. There are 25 upayantras according to Ayurveda. Medicine and Shara and Agni are 2 out of them. Rational therapy, we can divide 2: surgical treatment, non-surgical treatment, pharmaceutical therapy and nutraceutical therapy. Then pharmaceutical therapy we can divide it 3: herbal sauce, mineral sauce and animal sauce. Surgery is one of the 8 specialized branches. Ashtanga Ayurveda. In Ayurveda, there are surgical instruments, 101 yantra blunt instruments, 20 shastra sharp instruments. Medicine is one of the upayantra and anushastra accessory instrument, which can be used in the place of some surgical instruments. Removing surgicals and excision by medicine is one of the 24 utilities of upayantra. 8 types of surgical procedures: Chedya, Bedya, Lekya, Vedya, Ashya, Aharya, Visarvya, Sevya. Since the foreign bodies are of innumerable kinds of the intelligence, physicians may carry out the action of the instruments using his own intelligence. Case study. A 18-year-old female presented with a long medical history from the age of 9 years. A renal transplant has done on 30th of May 2004. She was on triple immunosuppressive for 5 years. The common complaint was about common warts over the face, both hands and legs for more than 4-year duration. The patient has undergone laser treatments, cryotherapy using liquid nitrogen gas and keratosis. She was mentally depressed, social handicap. Before treatments, her face.
Please, I'd like the audience to respect the speaker. So please, if you can take your seats.
Then I can start. Treatments. The patient was prescribed traditionally trusted herbal medicine paste called in Kadaradilepa, which descends from a traditional medical generation, Subhasingha generation. It is a widely used formula in treating callosities at BMRI and the effectiveness has been scientifically proven. Kadaradilepa contains tender leaves of Nephrolepis indica, Curcuma longa and Ferula nothrax. These are the things in Nephrolepis caudiflorea, Curcuma longa and progress. Then after 2 weeks, some warts have disappeared and a good response was observed. The same treatment was continued for another 2 months time. After 2 months of continuous this treatment, patient was fully cured. Follow-up studies was carried out in every 6 months for 2 years time. After treatments, she saw care. Discussion. The drug Kadaradilepa has Chedana, incision, excision, removing and Lekana scraping properties. The treatment improved the social well-being of the patient. The treatment can be used as permanent excision method for warts because she is still undergoing immunosuppressive drugs. The formula can be recommended as an accessory surgical instrument. Suggestion. Further scientific research is required to conclude the formula as an effective treatment for surgical condition. The product should be developed into an easily usable format as a readily available medication. This is my bibliography. Thank you.
Dr. Vipin Kumar, and the topic is management of ulcerative colitis through Ayurveda, a case report.
Respected chairperson, co-chairperson, reporter, coordinator and audience, I am here to present a case report entitled Management of Ulcerative Colitis. नीचे 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 थैंक यू एनलार्ज कर दीजिए. Management of ulcerative colitis through Ayurveda, a case report. Symptoms: diarrhea, patient को 8 to 10 times motions per day since 4 years, blood mixed stool since 4 years, pain or tenesmus in abdomen 4 years, mucus in stool 4 years, loss of appetite and weakness. Description of patient: name Mr. Satyendra Kumar, age 35 years, gender male, religion Hindu, district Muzaffarnagar UP, nationality India, appearance poor, physical disposition medium built, mental disposition average, madhyam sattva, occupation vegetable shopkeeper और lower socio-economic status का patient ये. History personal, diet vegetarian, sleep normal, bowel habit increase, maturation normal, addiction no, marital status married, children 2, family history, parents not alive, no history of any communicable chronic disease to any family member. Diagnosis: it is a pre-diagnosed by modern medicine investigations from 2 institutes, USG whole abdomen and upper GI endoscopy, GV Pant Hospital, New Delhi. Diagnosis was ulcerative colitis and UGI upper GI endoscopy. Diagnosis was distal proctitis and surgical pathology. Diagnosis was ulcerative colitis. It was done in PGI Chandigarh and BFT ulcerative colitis. आयुर्वेदिक संदर्भ, जैसे कि अर्लियर डॉक्टर महादेवन सर ने बताया, निदान के लिए सर्वश्रेष्ठ बुक है हमारी माधव निदान. उसमें इसका डिस्क्रिप्शन बहुत क्लियर कट, बहुत अच्छे से है, वाइड डिस्क्रिप्शन है. अंत्रकूजनम आलस्यम दौर्बल्यम सदनम तथा द्रवम शीतम घनम स्निग्धम सकटी वेदनम सकृत आमम बहु सपिच्छिल्यम सशब्दम मंद वेदनम पक्षान मासाद दसाद वा नित्यम वाप्यत विमुंचति दिवा प्रकोपो भवति रात्रो शांतिम व्रजेत या दुर्विज्ञा दुष्चिकित्सा चिरकालानुबंधनी सा भवे तामवातेन संग्रहणी मता. माधव निदान ग्रहणी प्रकरण. तो जो सिम्टम्स मॉडर्न पैरामीटर्स के IBS के या अल्सरेटिव कोलाइटिस के होते हैं वो हमारे माधव निदान में अक्षर से मिलते हैं. अंत्रकूजनम, टिनिस्मस, आलस्य, दुर्बलता और द्रवम शीतम, घन म्यूकस इन स्टूल, ब्लड मिक्स स्टूल. और ये बार बार कहा गया है पक्ष में 10 दिन में या 15 दिन में या डेली उसको ये विमुंचति हो सकती है. और एक इम्पोर्टेंट सिम्टम आया है दिवा प्रकोपो भवती रात्रो शांति व्रजेच. तो एक पेशेंट मैंने ऐसा भी देखा था जिसमें अब 10 से 12 मोशन की हिस्ट्री केवल डे टाइम की थी. दूसरा जो इसका रेफरेंस मिलता है रक्तातिसार पित्ताक्रंति यदा अत्यर्थम द्रव्यान्य स्नादि पैत्तिके तदोप जायते अभीक्षणम रक्तातिसार उल्लवण. माधव निदान. ये मॉडर्न का थोड़ा सा डिजीज के लिए पैरामीटर्स है क्योंकि यहाँ बहुत शॉर्ट टाइम है. इसमें ये आपको जो अल्सरेशन कोलाइट नॉर्मल कोलोन और अल्सरेशन का कोलोन ये दिखाया गया है. और लास्ट वाले फिगर में इसमें ये भी है कि इसकी ग्रेडिंग भी स्टेज वाइज आपको शो हो रही है. मैनेजमेंट, ट्रीटमेंट प्लान, lifestyle modification. Since it is a psychosomatic disorder, so we have to manage the lifestyle या चेंज द लाइफस्टाइल. In most of cases, symptomatic control and prevention of a relapse rather than cure. There are a number of lifestyle changes that can help to cope up better with ulcerative colitis patient. Counseling to cut the stress and anxiety. क्योंकि भागवत गीता में भी कहा है तद दुख संयोग वियोग योग. दुख का जो संयोग है वियोग वो है, और चरक में भी कहा है विषादो दुख वर्धना नाम. तो काउंसलिंग जो पेशेंट के स्ट्रेस और एंजाइटी को कम करने के लिए है, इस डिजीज में बहुत ही इंपॉर्टेंट है. लिमिट इनटेक ऑफ डेयरी प्रोडक्ट, मिल्क, चीज, बटर एटसेट्रा which may help reduce diarrhea. Eat slowly with frequent small meals. Adopt mild exercising routine. Avoid caffeine and alcohol. Take antioxidant-rich foods जैसे बनाना, आंवला एटसेट्रा. फर्स्ट फेज ऑफ ट्रीटमेंट जो हमारा था उसमें हमने पेशेंट को पंचामृत परपटी 250 मिलीग्राम, बिलवादी चूर्ण 2 ग्राम्स, कुटज घनवटी 2 बटी, संजीवनी बटी 2 बटी और गंगाधर चूर्ण 3 ग्राम, ये एक डोज पेशेंट को दिया गया, जो कि तक्र, जो इसको मट्ठा कहते हैं कुछ लोग, या मिल्क क्रीम कहते हैं, तक्र और भ्रष्ट जीरक और संदव लवण के साथ एक डोज दिन में 2 बार. चित्रकादी बटी 2 बटी बिफोर मील, कुचारिस्ट 10 ml आफ्टर मील, ब्राह्मी बटी 2 बटी HS सिंस इट इज ए साइकोसोमेटिक डिजीज टू कट स्ट्रेस द पेशेंट. सूल वजनी बटी और शंख भस्म SOS जब पेशेंट को कई बार इसमें टिनिस्मस या पेन इन एब्डोमेन ज्यादा होता है. तो अप्रोक्सीमेटली 50-60% रिलीफ आफ्टर दिस ट्रीटमेंट आफ्टर 1 month पीरियड. इन सेकेंड फेज ऑफ ट्रीटमेंट फिर मैंने और अपने सीनियर से, टीचर से कंसल्ट किया, तो उन्होंने कहा कि इसमें फर्दर ऐड करिए एबव रेजिम में स्वर्ण परपटी 125 मिलीग्राम ट्वाइस ए डे विद पिपली चूर्ण एंड मधु, और कुटज परपटी 250 मिलीग्राम ट्वाइस ए डे. अप्रॉक्स आफ्टर 2 months continuous treatment, approx 80 to 90% symptomatological relief was to the patient. ये हमारे सिम्टम्स थे. और बिफोर ट्रीटमेंट 7 अगस्त 13 कोई पेशेंट रजिस्टर्ड हुआ. आफ्टर दैट अप टू 10 अक्टूबर 13 तक का इसका जो सिम्टम्स हमने लिए, डायरिया, फ्रीक्वेंसी ऑफ स्टूल जो इनिशियली 8 to 10 यूनिट था पर डे, वो बाद में 3 to 4 रह गया. ब्लड मिक्स स्टूल, पेन और टेंडरनेस, ये आप स्लाइड में देख सकते हैं. एनीमिया, म्यूकस इन स्टूल, हर एक को हमने एक पैरामीटर पे लिया और इनमें ये चेंज पॉजिटिवली हमको देखने को आए. कंक्लूजन, सक्सेसफुल रिजल्ट वाज ऑब्जर्व ड्यूरिंग द ट्रीटमेंट पीरियड. इन दिस पीरियड पेशेंट वाज ऑन ओनली अवर मेडिसिनल सुपरविजन since it is a psychosomatic disorder, hence counseling was done to the patient time to time and it was much beneficial to the patient. Acknowledgement, Professor G.S. Tomar and Dr. Rakesh Mohan, गवर्नमेंट आयुर्वेद कॉलेज हंडिया इलाहाबाद, ये जो मेरे सर हैं, इनसे मैंने पेशेंट के लिए एक्नॉलेज किया, उनसे गाइडलाइन ली. थैंक यू.
Thank you. I would like to call Subhadra Karki for his presentation. Her presentation.
चेंज कर दीजिए.
Thank you. Honorable judges and all the respected delegates present here. A warm namaste from Nepal. Myself, Dr. Subhadra, presenting a case on management of pre-malignant squamous epithelial lesions along with female infertility through Ayurvedic medicines along with Pichu Karma, a case study. Low-grade intraepithelial lesions of cervix are early stages of precancerous lesions. The cervical cytology is just at a start to change. The change might be in size, the number, or the shape of the cells, and they have only few abnormal characters. They may progress to high-grade lesion and subsequently turn cancerous if they are not detected in time. So, and also the causes can be due to infections, that is human papilloma virus, healing from minor injuries, or it can be idiopathic also. So presenting a case, a 31 years old lady, fairly nourished, non-diabetic, non-hypertensive. She came to me with a lower abdominal pain. The pain was slow in onset. It was gradually increasing in the last 6 months time, and since 1 month it was aggravated. And also she also complains of a back pain. It was also started along with the abdominal pain. All the pain, like the abdominal pain as well as the back pain, were non-radiating type, and it was dull in nature. Also, she has a vaginal discharge that is a thin watery type, and it is non-itching and it's non-odorous. She also has increased weakness, increased anxiety, disturbed sleep, and loss of appetite. Also, this was the major symptoms that made the patient come to us. But also there was a problem with the couple, that they were trying to conceive since last 2 years, but they were not able. So this is the description of patient, 31 years lady. It's already told before also. The major complaint is the pain in the lower abdomen and the back pain, discharges, and being unable to conceive. On the examination part, the general condition was fair. The chest, CVS, CNS, all the things were normal. On per abdominal examination, it was soft. There was tenderness in suprapubic area. There was no any organomegaly. Per vaginal examination, cervix was normal in position. It was slightly tender in motion, and uterus was normal in position, and furnaces were bilaterally clear. Per speculum examination, mild erosion was there in cervix, and also water discharge was there. So these are the reports that were available at the time of first consultation. The USG report showing bulky uterus, and the urine test was normal. Also, in the history part, bowel was irregular. It was slightly constipated also. Urine was normal. Sleep was slightly disturbed with illness, and appetite was low. Menstrual history was regular, but it was painful since last 3-4 cycles, and clots were also present. Obstetric history, the patient has a 6-year-old daughter, and she had 2 medically terminated pregnancies before. And contraceptive history is none right now, and the family history is non-significant. So the diagnosis was made according to the pap smear results. It is diagnosed to have a low-grade intersquamous lesion in cervix. After my first consultation, I advised her for a pap smear test, and since the USG reports already showed it was a case of bulky uterus, and before coming to me, the patient was conservatively treated in the line of PID, pelvic inflammatory disorder, with analgesics, with antibiotics and steroids. And in Ayurveda, such lesions are not described independently, but in accordance of its symptoms, we can correlate the case to be with Sannipata Yoni Vapad, where Vata, Pitta, and Kapha all are involved to bring out the respective symptoms of Sula, Daha, and Srava. And it also it can be named as Garvashaya, Griva, Gatabrana. So in the first consultation, what we did was we started with a Triphala Churna for a mild laxation, and also Lakshari Gugul for pain management, and also the Stambhana of Srava. And in the external medicine, in the external part, the washing of vagina with Triphala Vatha was there. And in the first consultation, patient was advised for pap smear report. And in the second consultation was after 5 days, and since the patient came with the pap smear report with the presence of low-grade intrasquamous epithelial lesions, so a combination of Rasoshad was made, and also a classical preparation of classical arista preparation, like Asokarista was also given along with the Lakshadi Gugul, and the Pichu Karma was started with Dasamula and Satavari Tela for 10 days. And okay, and in the third consultation, the medicines was continued as the patient was exhibiting a marked relief in all the symptoms he was exhibiting before. So in the fourth visit, the rososity was stopped and the uterine tonic was given. Since the patient came with, in the fourth visit, the patient again comes after, it was the duration of 2 months, and the patient was coming with a pap smear report again. And in that pap smear report, the intrasquamous epithelial, any sorts of lesions were not there, and patient was also having a significant relief in the symptoms that were exhibited before. So all the rososity also was stopped, and in that particular time, so the patient also comes with the pregnancy positive result. So Roshashadi was stopped, and she was suggested to visit ANC clinics. So the justification is Triphala Churna is Tridosha Samaka and laxative also, both used for laxation, also for washing also. And Lakshadi Google has a Bhatahar and Lekhana properties. The mineral composition was the mineral resource composition has, since we all know that all the resources can go deep into the cellular level and make changes in the cellular level, like they can have the mutagenic effects or something like that. The resource composition was working in that way, and Pichukarma, it helps locally in Sodhana, Ropana of lesions, and also since the Smula and Satavari was used, so Sulaharana and Bata Samana and Ropana was done with its nourishing effects. So the course of treatment, as we discussed, it was 2 months plus 1 week total duration time, and in that duration the patient was relieved with the initial symptoms also. And in the course of treatment, since though the treatment like the infertility problems since they were facing since last 2 years was our second plan, but in the course of treatment only she got pregnant, and it was a good thing. So this is the just the chart showing how she responded with our treatment in the subsequent visits. And this is the result of the 2 pap smear tests that were before and after treatment. And this is the obstetric scan and ANC card of the patient. So the conclusion is patient responded quite well with the treatment, and symptoms started subsiding with the use of treatment. So these are again the USC reports that are showing the pregnancy. So as per case study, the approach of Ayurvedic medicines and procedures have been found successful to cure lesions. The medicines were found safe, and the duration of intake was 2 months. In this period, not any discomfort was felt. Instead, patient has increased appetite, decreased anxiety, and feeling of wellness also. So, and the similar thing, the second infertility case was our second plan, but in the course of treatment only it got treated. So this 2-month-long treatment worked amazingly in elevating the symptoms and preparing a healthy environment for pregnancy. And internal medicines and Pichukarma combined therapy worked efficiently in clearance of lesions. I highly acknowledge Dr. Basudev Upadhyay, Director General, Department of Ayurveda, Ministry of Health and Population, Nepal, for his generous support. Dr. Anupam, my dear colleague, for being always there, and Dr. Amrita, my evergreen supporter, and Dr. Vijay, my brother, for being there, and my mom and dad for making me come here from so far. Thank you.
I would like to call Manchak Kandre.
Respected eyes and my friends, the topic is a rare entity, urinary bladder amyloidosis, treated as a Mutra Margagat Adog Rakta Pitta, a case report. Primary urinary bladder amyloidosis is a rare entity. In modern literature, 200 cases are reported worldwide till 2002. Amyloids are waxy, starch-like, insoluble fibrous protein aggregates sharing specific structural traits. Amyloidal proteins are manufactured by malfunctioning bone marrow. These amyloidal proteins deposits in the bladder tissue, leading to tumor-like appearance, chronic recurrent cystitis, and recurrent frank painless hematuria. The etiology of the primary bladder amyloidosis is unknown but considered as immune-mediated. The treatment is usually conservative, that is observation or transurethral resection of bladder tumor. Long-term follow-up is recommended because recurrence is observed in above 50% of the cases. A 45-year-old male case was reported to Kai Chikitsa OPD in December 2011 with the complaints of recurrent gross blood in urine once in 2 months for 3 to 4 days without burning or pain. Subjective parameters, recurrent painless gross hematuria. Objective parameters, USG abdomen showing growth in urinary bladder, cystoscopy showing growth in urinary bladder. Biopsy of the bladder lesion for histopathology is negative for malignancy and positive for Congo red stain. Investigations conducted by urologist and results. USG abdomen is showing growth on posterior wall of the urinary bladder. Cystoscopy is showing nodular growth on posterior wall of the urinary bladder. Biopsy of the bladder lesion findings consistent of multiple dark brown tissues all embedded in 3 cassettes. Congo red shows apple green birefringence under polarized light. ISC with the appropriate controls for amyloidal P component is positive. Significant finding in urine microscopy is plenty of RBCs. Other general investigations and clinical evaluations are within normal limit. Name patient Jignesh Kumar Hirabai Patel, 45 years, male, NRI from Anand, Gujarat. And patient's occupation is manager and socio-economic status is higher. Presenting complaints of the patient. Doctor, I am suffering from gross blood in urine once in 2 months for 3 to 4 days without burning or pain. Findings, subjective red color urine since a day. Objective finding, significant finding in urine microscopy was plenty of RBCs. Diagnostic investigations were already performed by the urologist. Ultrasound examination showing small polypoid mass in the posterior wall of the urinary bladder. Then cystoscopy showing growth in urinary bladder with edematous wall. Then Congo red stain of biopsy material showing characteristic apple green birefringence of amyloid deposition. History, no relevant personal or family history to this disease. Change in food pattern, burger, pizza, preserved foods, and mild work stress. Diagnosis, allopathy diagnosis was already done by the urologist as a primary bladder amyloidosis on the basis of painless occasional gross hematuria, and histopathology of the bladder lesion is negative for malignancy and positive for Congo red. Ayurveda diagnosis. This case of primary bladder amyloidosis is diagnosed as Mutra Marga Adhog Rakta Pitta on the basis of important symptom Rakta Nirgam through Mutra Marga. Treatment plan. Adhovahe Rakta Pitte Vamanam Param Uchyate Vamanam Madonon Mishro Mantah Sakshaudra Sharkarah Sa Sharkaram Va Salilam Ikshunam Rasa Yevova. Langan was given for initial 3 days. Diet in little quantity was prescribed after proper hunger sensation. Kharjur, mantha and yawagu of shastik shali rice mixed with the dadim ras was given as a diet. Snehapan with Vasagrit 100 ml daily for 7 days with lukewarm water at 12:30 pm. Yawagu of shastik shali after hunger sensation. Then after proper Snehapan, Abhyang with Amrutadi Tailam and Guru Pravaranam as a Anagni Sved before a day of woman, and woman on at 7th am on the day of woman. Abhyang Svedan was also given. Shashti Shali mixed with sugar and milk diet before a day of woman. Yukshurus 1 liter was given. After Yukshurus, Madan Phal 20 gram, Madhu 20 gram, Sharkara 20 gram, and month was prepared and given for the woman. After Samyak woman, Sansarjan Kram was followed for the 5 days. Then as a shaman medication, after Sansarjan Kram, Vasagrit and Dhanya Gokshur Grit was given. Vasagrit early in the morning 30 ml and Dhanya Gokshur Grit before dinner. Probable action. Woman is best for Adhog Rakta Pitta. It acts at the molecular level to normalize the function by Prabhav. Vasa is best for Rakta Pitta. That is also act by Prabhav. Gokshur is best Mutra Krutya Vatharanam. Observations at midpoint. Red color urine becomes white color on the 2nd day of Snepan. On 3rd day of Snepan, urine microscopy shows 1 to 2 HP of RBCs On 7th day, same. And after woman, that is on 10th day, urine microscopy shows nil report for the RBCs. Progress of the treatment. Patient is receiving shaman treatment regularly along with the pathya and yearly woman karma in December. He is keeping 6 monthly follow-up of urologist and yearly follow-up of the Kai Chikitsa department since 2 years. His USG cystoscopy report is not showing any growth in urinary bladder. After first woman, frequency of hematuria was reduced from once in 2 months to once in 3 months. After second woman, frequency is reduced from once in 3 months to once in 6 months. Duration of hematuria was reduced from 3 to 4 days to 2 days after first woman. After second woman, duration of hematuria is reduced from 2 days to 1 day. Outcome same. Then before treatment, after treatment comparison. Before first woman, hematuria once in 2 months. After first woman, hematuria once in 3 months. Before second woman, hematuria once in 3 months. After second woman, hematuria once in 6 months. Before first woman, duration of hematuria was 3 to 4 days. After first woman, duration of hematuria was reduced to 2 days. Before second woman, duration of hematuria was 2 days. After second woman, duration of hematuria is reduced to 1 day. Before first woman, karma urine microscopy was showing plenty of RBCs. After first woman, nil. TU-RBT was done elsewhere. Yearly follow-up of USG and cystoscopy has not shown growth in urinary bladder up to 2 years. Conclusion. Algorithmic management yearly woman therapy, Vasagrita and Dhanya Gokshurgrut is showing positive results in primary bladder amyloidosis. Long-term treatment plan along with regular follow-up is required to improve such irremediable disease. Recurrence is very common in this disease, hence long-term treatment and follow-up is required for proper conclusion. Patient is not receiving any allopathy medications for this disease, hence treatment efficacy is not suspicious. Thank you.
Now I am requesting to our chairperson Bhandari sir for actually Dr. Mahadevan is for another lecture. Other hall person is waiting for Dr. Mahadevan, so I am requesting chairperson sir, please.
Side,
You not you.
Thank you all. Thank you very much.
Thank you very much, sir.
Keep in touch, please.
Sure.
Oh, sir. Now I would like to call Chandrika Velvet Goda for her presentation.
Good evening, welcome. Yeah, welcome. We are very proud. Sri Lanka has so much Ayurveda tradition. I have those two wonderful doctors with me.
With herbal medicine. So you can see the introduction. Coronary heart disease deaths in Sri Lanka reached very high figures. I will short the presentation that you can see WHO publication in 2011 published, that is around 11.69% of total deaths in 2008 in Sri Lanka. Next, you can see the existing data, that is the risk factors for ischemic heart disease were identified as 7. Out of that 7, 1 or more lipid abnormality causes 37%. It was found by Katulanda et al. In 2010. So, management of hyperlipidemia with lipid lowering therapy according to the treatment of Ayurveda system is very important, because it is very hyperlipidemia is major modifiable risk factor. We can do that. This is a single case study I will explain next. So purpose of this study is to evaluate the clinical efficacy of polyherbal formulation, 3 formulation, that is Shaddarna, Karyadi decoctions and Lekanadi powder, according to the treatment principles in Ayurveda, that is Ampachana, Shodhana and Shamana treatment principles followed in this case.
Madam, I'm interrupting you. Yeah. Kindly conclude your case as early as possible, within 5 minutes.
Okay.
Actually, many person is waiting.
Yeah, this is the patient's history, clinical examination findings and research method I followed. And patient history, he was 55 years old male patient presented with headache and giddiness. And you can see the baseline figures of lipid profile according to allopathic treatment system, medical system diagnosis. And I will explain the next 3 column in the results. I have selected the treatment plan Dravyamaya Chikitsa and Adravyamaya Chikitsa from the Charaka Sanghita. You can see the table in how I applied these decoctions, method of preparation, dose and duration, and after that lifestyle modification according to patient's education, actually traditional food pattern in Sri Lanka, and I don't have time to explain. So I will proceed with these decoctions, ingredients and pharmacological properties in the according to Ayurveda system, that is Rasa Guna Virya Vipaka. These are the whole slides about that. The results, if you can see after the treatment, basically we have found the parameters as this, and after treating nearly 21 weeks we didn't get good results, but however the patient consented to follow the treatment, that is around 28 weeks or 36 weeks we got good results. After that we followed the patients again, we have found very good results with these treatments. So even treating with 52 weeks of Ayurveda treatment, patient didn't get any liver profile derangements. And the discussion, so we can see 3 different herbal formulations consecutively applied, and according to Ayurvedic principle, cleansing the channels, that is Shrota Shodhana, digestion of byproducts of Dhatu Paripachana, that is Ampachana, stimulate the process of Agni, and Dosha Samana. So I have selected these Charaka Samhita, the principles, and you can see Dravyamaya Chikitsa as this, and comparison of the 3 formulations. You can see Katuka Tikta Kashaya is present predominantly. So I have referred how Katuka and Tikta Rasa affects in the body. You can see this stimulate the Agni, that is Katuko Raso, like that. You can see Shonita Sanghata Binanti, that dissolve the blood clots, and bonds are Chinanti, and Bandhas Chinanti, that means bonds are divided, and Margan Vivarnoti, that means channels are open. That these all are mentioned in Charaka text. So we can select this Dravya Guna Karma from our main text. So present study conclude that refrain from the possible causes, that is samprapti vigatana, treatments following the basic principles in Ayurveda, lifestyle modification with regain in traditional food practices and increase in physical activities, successful and safe way of management of hyperlipidemia, thereby reducing the risk of cardiovascular diseases. So my references are this, and this is my acknowledgement.
Thank you. Now I would like to call Mahesh Prasad Shah.
ये मेरा नहीं आप देखिए कौन सा है बता दीजिए which one is yours ठीक है
काठमांडू में
चेंज कैसे हुआ इसे Good evening, everybody. Good evening, everybody here, and respected sir. I am Dr. Mahesh Prasad Shah from Nepal. My topic of management of Guillain-Barré syndrome, with respected to Sarvanga Pakshaghata through Panchakarma along with Ayurvedic medicine case study. Let's try to wind up it 5 minutes. A baseline of 38 years old female patient having weakness in upper and lower limbs, sudden onset quadriparesis. She admitted to government hospital where all investigations were done. Routine and other examination were normal, but blood sugar increase and CSF suggestive of GBS, and she diagnosed GBS with new onset of DM. She got all possible emergency treatment in ICU for 22 days, that is injection, IV, IG and so on. But she didn't get improvement and referred to physiotherapy. Then she got 1 month physiotherapy, but she got not relief. Finally, she came to me after 2 months after of her condition where she was unable to sit and stand, that is quadriparesis. She reported respiratory discomfort and insulin increased symptoms. Her past family and social history was unremarkable. Clinical examination revealed decreased muscle strength in all extremities with hypotonia. Next description of patient. 38. If you can just skip, it's not important. Okay.
Just wind up within 5 minutes.
Present the main.
Complaint weakness of upper and lower limbs, loss of movement, upper and lower limbs, respiratory discomfort, constipation, insomnia, loss of appetite. Clinical finding, all are normal, but CNS examination, nutrition bilateral equal, tone, hypotonia, all four limbs, power 0/5 left lower limbs and left upper limbs, and right 1/5 palmar. Reflexes diminished, plantar absent, sensory nerve examination, WNL. History, personal history, no preceding history of fever, cough, chills, loose motion, trauma and spinal cord. Diagnosis, I diagnose her Sarvanga Pakshaghata as per Ayurvedic diagnosis. In Ayurveda, such GBS are not described independently, but in accordance with symptoms, it can be correlate with Vata and Kapha dominant symptoms. Treatment planning of Panchakarma therapy. First of all, Basti Chikitsa, Karma Basti 30 days, and oral medicine 1 month, and include injection human mixed hard insulin. Continue 2 months, my treatment hour. Following Basti procedures, Dipana Pachana. For Dipana Pachana, Chitrakadi Bhati 500 mg TID 5 days. Purva Karma Sahasradi Vaila, dose 150 ml, duration 45 minutes per day. Swedana Sarvanga,
Dasamula Churna 100 gram dose, duration 20 to 30 minutes per day. Anubasana Basti, while Mahanarayan Tel, Niruha Basti are Bala Mula, Ashwagandha Mula, Satabri Mula, Eranda Mula, Dasamula Churna, etc. Observation at the midpoint, the significant result like her weakness was reduced and she got strength in her upper and lower limbs. She was able to sit and stand with the help of others. She became more cooperative and free anxiety. Progress of the treatment during Panchakarma, last day of first week, last day of second week, last day of third week, last day of fourth week. Finally, she became completely cured from Sarvanga Pakshagata and diabetes and back to her daily routine of her life successfully of other treatment during my treatment. In conclusion, Sarvanga Pakshagata GBS patient can be tackled by allopathic treatment at the time of emergency but cannot be cured fully in most of the cases. So I prefer Panchakarma therapy along with Ayurvedic medicine suggested to get completely relief from deep root of the disease. Enclosement.
Sir, skip
Thanks.
this. Thank you. Next, Birendra Shah.
So please try to be as short as you can. Just present the main. Points.
Respected Chairperson, judges and all delegates, I am Dr. Vijendra Shah from Kathmandu, Nepal, and I'll try my best to complete within the time limit. And the topic of my presentation, it's a study, is the efficacy of a char karma in management of the second and third degree hemorrhoids also. Introduction, char karma is a process of application of Pratikshna Chara is a non-surgical procedure and it's alkaline in nature and it's a based parasurgical by the Sustrut in a various surgical element and it is a superior Sastra Anusastra potential for Sedan and a Vedan and a Lekhan because of their powerful elimination to 3 doses. And I have taken 4 cases. First cases of 41 years males with a second degree hemorrhage at 7 o'clock, and second cases is 29 years males of the third degree hemorrhoids at 11 o'clock, and third cases is 21 years females of second degree hemorrhoids at 3 o'clock, and 47 years males of second degree hemorrhoids at 7 o'clock. I am planning for char karma, and the aim and objective of my study was to catalog the role of the char karma in management of second and third degree hemorrhoids, and to focus and enlighten the path based on the char karma principle for the few research scholars, and objective is to simplify the basic surgical approaches. Materials and methods. Materials is the Pratikshna Chara, which includes the Apamarga, Sukti powder, Chitrak, limestone and Sankha in the guidelines of the given by the Susruta, and patient selected here we have randomly of different sex religions of patients from the Nepal Ayurvedic Panchakarma, and the inclusion criteria is with a different age having a files of second third degree hemorrhoids, including this study, and where exclusion criteria is I have excluded the patient of the carcinoma, hepatitis, heart disease, and 4 degree files, external files, and tuberculosis, inflamed, and thermose files. And for assessment, I have following guidance patterns was adapted for the scoring this criteria for pain, severe, mild, moderate, nails, and discharge severe, same as, and tender as a severe, moderate, mild, and the nail. The methodology was as described in our classicals. The first we done the Purva Karma done as with a consent of a patient with the perianal hair removed and orally orally make it nails and IV tetanus, IV IM is given, IV open is IV line is opened, and operative procedures is done as a prescribed in the standard base of the operation table. Local anesthesia was given, and as a every suspected conditions we have given by the special slit protoscope examination carefully, and third application is done with the probes, and after that we do the pastat karm, this post-operative. In these cases, after counting 100 or within the nature of tissue, you can neutralize by the wash out with the completely with the lemon water acidic to neutralize that alkalis, and after or liquid after 6 to 8 hours har karma restricted to the diets, normal diets, and in a different signs as for the proper cauterizations, and that the sign of samaka, hina, and ati, and objection and results during this each following visit. Signs and symptoms were the discussed, and which is shown this another table. And Charkam was significant improvement on the clinical features, and it overall the therapies of Charkam 100% of the patient got cured, and that is a improvement chart. First visit, second visit, and third visit, and improvement, and at last third visit, and color of scar only is seen, and all improvement is the and we also here we got the 100% result. And discussion. In discussion we have the in 21 days we found that it's a total effect of char karma, and it's the same as before. And conclusion, this study was manifest that the Pratinayatics chara was found to be effective or weakening in second, third hemorrhage also, and char karma procedure can be done on the OPD level too, and antibiotic and anti-inflammatory drugs requirement are very less, and there is no adverse effect during this post periods like the stenosis, strategy, incontinence, and bowel irrigation. This study finally manifests that the combination of the char karma, conservative treatment, diet, restriction, and lifestyle modification over the period of the minimum 6 months is effective in the obligating the second and third degree of false mass, as well as preventing the reoccurrence of long-term basis. And this is the before, the after, and during the treatment. And thanks.
Thank you. Next, Vidhu V. Maheshwari.
Kindly conclude.
Heartily welcome to all of you. Myself, Dr. Vidhu Maheshwari from the Department of Kaya Chikitsa, DGM Ayurveda College Medical Gadag. My presentation topic is DMD, Ayurvedic Management Case Study. This is the introduction. Description of the patient. Main the complaint of the patient. Chief complaints: mom share, block share. More than 7 years. Associated complaints was difficulty to sit and stand. Difficulty in attending daily routines. More than 7 years. The history of patient present illnesses. Patient's parents observed above mentioned lakshanas when the child was 1.5 years old. The child had full-term normal delivery as per history given by the patient's parents. Patient's parents are conjugal marriage. Diagnosis was made based on clinical features of DMD like proximal limb weakness, calf muscle pseudohypertrophy, contraction of the heel, lumbar lordosis, and the presence of Gower sign. This is the treatment plan. Sarvang Abhyang with Vala Ashwagandha Tela, Nadi Swed, then Vasti in Kal Vasti pattern, and Vasan Vasti Mans Mahamash Tela, and the Niru Vasti Mustadi Apna Siddha Vasti. Physiotherapy, active assisted exercise and strengthening exercise for 16 days, Shavan Yoga, Aja Mamsa San, Bala Distant the capsule bone tone. This is the posology. Sarvang Abhyang with Vala Ashwagandha Tela for 16 days. Vasti, Mustadi Yapna Vasti, Vasti pattern Kal Vasti, in which 10 Anuvasan Vasti and 6 Niru Vasti was given. Anuvasan Vasti with 50 ml Mahamashtel and the Niru Vasti Mustadi Yapna Siddh around 250 ml. Shaman Yog Ajamamsa Sayan 1 TSP before food along with sheer 2 times a day. Balarista 3 TSP with equal water after food. Capsule bone tone and total duration is 16 days. This is the treatment schedule. Action of the medicine. Bala Ashwagandha Tel. Pushti Karaka indicated in Karshata and Vataroga. Mahamasha Tel indicated in Alpachalan Shakti, Hastapad Shirokampa, Khanje Panju, Khanje Pangu and Sarvavati Mustadi Yapnavasti indicated in Janu Uru and Jangashul, help in Mams Bala Vradhi. Bala Rishtha, Bala Pushtikarka, Agnivardaka, Ajamamsa Sayan, best for Dhatukshaya and capsule bone tone indicated in Asthi Shortshaya, Asthi Shaya, Asthi Shul and Asthi Vikara. This is the result. Before treatment, muscle wasting present on both shoulders, chest and thigh. After treatment, there was minor improvement. Secondly, stony hard calf muscles present on both lower limb. After treatment, become smooth with movable. Before treatment, he was frequently fall 3 times per day and wounds. After treatment, frequency of fall reduced. Mean the Grover's signs. Fell down on the ground immediately when asked to sit. After treatment, comfortably sit on the ground with slight difficulty. General appearance before treatment was ill looking, after treatment was good looking. Discussion. For this disease in Ayurveda, we may consider the concept of Asthi Majjagat Vata and the Fakroga, in which the symptoms of DMD.
Subjective matters.
Okay. This is the conclusion. DMD is a genetic disorder. Ayurvedic line of measurement may not acting at gene level, but help to increase the patient level. Ayurvedic treatment measures like Abhyang Vasti, Shaman Chikitsa and Rasayan therapies may enhance the general condition of the patient. We can add years to the life of patients. Acknowledgement. Thank you.
Thank you very much. Next, P. Dibya. Present? Okay.
Respected dignitaries on and off the dais, dear doctors, a very good evening to all. I'll try to make my presentation as short as possible. I'm here to present a case on primary lateral sclerosis. Going on to the baseline data, it's a pre-diagnosed case of primary lateral sclerosis which was diagnosed in Poland, and the patient had spastic paralysis and edema of lower extremities with indistinct speech, rhinolalia and bradylalia. He was psychologically depressed and muscles of the interphalangeal joints of upper and lower limb and calf muscles were very rigid. Then moving on to the description of a patient, he was a 60-year-old male with polychirurgian with a well-built structure. He was physically challenged and mentally depressed, and he was from an affluent family. The complaints were progressive weakness of upper and lower extremities for the past 7 years, progressive speech disorders for the past 5 years. The condition, even though the condition was progressive, it remained stable for the last 3 years, and aggravating factors were cold climate, negative emotions, and stress. These are the findings. Bilaterally positive plantar reflexes. Sleep was disturbed. BMI, as I told you, was 32.28. Muscles of interphalangeal joints of upper and lower limb and calf muscles were rigid. And there was multi-level cervical spine discopathy in MRI and had third-grade edema. These are the features of Kaphavrta Vata that he was showing as per the diagnostic Ayurvedic criteria. I am not going into the details. You can see the positive signs in the slides. These are the symptoms of Kaphavrta Prana, Kaphavrta Udanavayu, Kaphavrta Vyana. You can see all the symptoms are positive. Kaphavrta Samana and Apana. For Kaphavrta Apana Vayu, all the symptoms were negative in the case of patient. Regarding his history, he was a non-vegetarian by diet with good appetite, with normal bowel and bladder, with an outward sleep. He doesn't have any energy, had a history of arterial hypertension, hypercholesteremia and gout, and there is no relevant family history. The diagnosis, as I told you, is primary lateral sclerosis. PLS is a condition which is having an incidence of 1 in 1 million, but the prevalence is about 10 to 20 per 1 million since it is a chronic condition, and there is no definite criteria to diagnose PLS. How we diagnose is it? We observe the condition of the patient for the first 3 years. In that case, amyotrophic lateral sclerosis, ALS and PLS is similar. If the patient doesn't develop any signs of lower motor neuron lesion in the 3 years, then it is considered as primary lateral sclerosis. So the Ayurvedic diagnosis that we have taken here is Kaphavrtavada with involvement of Prana, Udana, Vyana and Samana. So moving on to the treatment plan, here the treatment is divided into 5 different phases. This division is done entirely for the ease of presentation. The treatment and the medication were selected as per the condition of the patient and the response of the patient with the previous medication. So the first phase was Rokshana with, that is Udvartana. Second phase Rokshana with Sangarasve, that is Kolagulathadi Churna and Dhanyamla. Third phase was Snehapana with Mahanarayan Taila. Fourth phase was Vedana and Virechana. And fifth phase was Yogavasti. Moving on to the progress of treatment, after the first phase, that is Udvartana, there was substantial reduction of edema, increased appetite and slight reduction in joint stiffness. After the second phase, pain developed in L4, L5 region and there was dull ache throughout the body. After the third phase, that is Snehapana with Mahanarayan Taila, that began with, we started with 25 ml and ended with 115 ml. All the symptoms worsened, the patient became lethargic and all the improvement he had during the first 2 phases were reversed. And after first phase 4, that is repeated Svedana and Virechana, he felt very light, was able to walk freely without crutches, but we didn't allow him to walk for long distances, was able to move all his phalanges independently and was able to grip his footwear. After phase 5, that is Vasti, he started feeling weak just on starting Vasti, and the patient was advised 3 days rest after treatment and was not allowed to move out of the house. So when comparing the condition before and after treatment, regarding gait, before treatment he had toe walking and he was walking with the support of walking sticks and there was a forward tilt in the body and his left foot was dragging. And after treatment, he walked 2 kilometers, I'm not exaggerating, 2 kilometers without any support and tiredness, and he walked with a straight body stance. Regarding edema, he had pitting bipedal edema which reversed after treatment, and the thumb opposition was not possible in ring and little fingers before treatment, which got reversed after treatment. Regarding the gripping of fingers, he was not able to grip his footwear, and after treatment he was able to do so. Regarding spasticity, before treatment all major and minor joints were spastic, whereas after treatment the spasticity was absent in minor joints, whereas the major joints, that is cervical and hip joints, were affected even after treatment. Rhinolalia and bradylalia were absent, and regarding swallowing fluid, the choking that was present before treatment was reversed, but the bilateral positive plantar reflexes that were present will remain as such even after treatment. To conclude, primary lateral sclerosis is correlated to Kaphavrtavada here, and the treatment consists of Rokshapana, Snehana, Svedana, Virechana and Vasti, and the patient was not having any other medication at the time of treatment. There was marked improvement in the condition of the patient, and the patient who had assisted walking was able to walk 2 kilometers without any support. Here we are not claiming that we were able to cure the condition completely, but what the point is that we were able to facilitate a better life for the patient. That itself we feel is a very good achievement in our science, and I know it's a single case study, so to claim the efficacy of our science in such conditions we need to go for extensive researches. And with this I come to the end of my presentation. Thank you so much for giving me an opportunity.
Thank you. I am requesting our chairman, sir, please conclude this session.
Yeah, so we are skipping our own concluding remarks, and I'll request our organizers here, if they have the certificates to be presented, we can do that since we are already 1 hour behind schedule.
Good evening. Hello. So, thank you for your patience hearing. So, first of all, I like to congratulate all the audience. Now, I request Dr. Sumer Singh to please felicitate our guest in the dais. Certificate there. Certificate there. And Dr. Chajuram Yadav also. And Dr. Chajuram Yadav. Now I request our chairman sir and our co-chair sir to felicitate our participant and the speaker, Dr. Ruini Mendes. And Vipin Kumar. मुंचे केंद्रे. डॉक्टर सुभद्रा कैकरी. डॉक्टर चंद्रिका. डॉक्टर महेश प्रसाद शाह. डॉक्टर विजेंद्र शाह. डॉक्टर विधु भी माहेश्वरी. and Dr. Divya P. So thank you all for your hearing, and thank you our guest in the dais, and thank you all, and thus we end our second session. Good night.